Speaker. Public-private partnerships in health over the past decade have been increasingly used to deliver infrastructure, clinical services and health promotion by leveraging private sector expertise and capital. This is because of many factors, including the choice of private partners, stakeholder interests, and private partners cite improved hospital efficiency and patient satisfaction statistics, but face challenges regarding high bid costs and potential conflicts of interest, especially in health promotion. I preface my speech with a genuine, in-principle acknowledgement of the role of the private health service in Bowral. They provide community with an alternative choice of medical care, extensive list of specialist care for various diseases, and reduce the waiting list for care in the public hospital. Many of those using the private hospital report high patient satisfaction. In the electorate of Wollondilly, Ramsay Health Care, Australia's largest private hospital operator, an ASX-listed company, operates Southern Highlands Private Hospital in Bowral. Ramsay Private Hospital is next door to the Bowral and District Hospital, literally on the same block. South Western Sydney Local Health District is the governing body responsible for the public hospital. What is little known about these two organisations is that Ramsay Healthcare has an arrangement in place to provide cancer and infusion services for both private and public patients in the Southern Highlands Private Hospital. That is, an exclusivity agreement. I raise this in the chamber to bring attention to the still trending privatisation of health services to Ramsay Healthcare. This trend is because of growth in ACC merger, acquisition and divestment notices involving Ramsay Health. The previous New South Wales government, in concert with, and to a lesser extent the Australian government, have transferred services and staff responsibilities to the private sector, possibly eroding diversity of choice and value of public health care. Bowral Hospital is not an isolated case study. It is reported in Ramsay Healthcare's annual report they operate private hospitals in WA, Queensland, Canberra, Victoria and globally. While it is reported by patients that they appreciate the service to our community, there is minimal evidence-based data in the public domain to explain how, when and why, and who implements, monitors and evaluates the private hospital cancer service to our public patients in Bowral. I raise this to our government to ask about their intentions to establish cancer health services at Bowral District Hospital and the future of public services within the Southern Highlands Private Hospital. In 2022 and 25, New South Wales parliamentary inquiries and reports found that remote, rural and regional communities were paying more out-of-pocket expenses for healthcare. Government responses to those inquiries referred to the growth of the private-public partnerships to increase the extent of healthcare access in selected rural and regional communities. It is appropriate time to conduct an independent audit to ensure public monies are spent appropriately, review opportunities, risks and the sustainability of continuing and expanding cancer health services options in the Southern Highlands region. So while the service is provided and constituents are continuing, some of my constituents are continuing to have to present to Campbelltown, the Illawarra and Liverpool hospitals and claiming the IPTASS financial subsidies to access cancer healthcare more than 100 kilometres from home. I question whether the sole use of the private hospital has or is abating the lessening these environmental and social concerns. I ask the government to confirm their intentions to continue, expand or augment the public cancer patient model at the Southern Highlands Private Hospital, or will they eventually transfer patients to a specialised public cancer treatment centre? Notwithstanding the fact the New South Wales Government was heavily invested in the Bowral and District Hospital, Stage 1 was 68 mil and a further 55 pledged for Stage 2, no cancer health services to improve access, affordability and equity to services were committed to by the government. The public deserves to know the implications, for better or worse, of resourcing public cancer health in Bowral by a private health corporation versus the delivery in the public hospital. We need to understand the use of the public purse. It should provide an evidence base to confirm whether the PPP is adding tangible cost efficiencies to the public health system, improving patient access and affordability of public health service in the Wollondilly electorate.